Metro Talk. I'm Kent Shuffle. Thanks for being with us. Sam Stem, the President and General Manager of WBGZ, is here. Welcome, Sam.
Good to be here, Kent.
And Jim Schrader, the publisher of the Telegraph's alongside. Welcome, Jim.
Hi, guys.
Jim, veto by Governor Quinn cut $276 million from the state budget. That's money that was going to be used for Medicaid purposes. People who said that money should stay in the budget say that's really not money we can play with. That's money that was going to go towards bills for doctors and hospitals. However, the governor or the legislature failed to override the governor's veto. That money is now gone. That means that's money that's not going to be used to pay existing bills. Was the legislature right in not overriding the veto? Was the governor right in taking that money out of the budget?
Well, the difficulty is that those services will still be provided. What I guess most people don't know or may not know is if you show up to the emergency room and you are bleeding and in imminent danger of your health, the hospital has to treat you. They have to, stop the bleeding. They have to do anything to keep you going. They just can't say, well, I'm sorry, you don't have a credit card or you don't have insurance. You'll just have to head on down the road. So some of those services will still be provided and there's no method to pay for it. So apparently the doctors and hospitals will provide the services with no hopes of getting the money back. I think that's a great idea. I'm a little short in my cash flow right now, so I've decided to stop buying groceries and have no money for groceries to buy. But I'm going to go out to dinner every night and let the restaurant pick up the tab for my meal. So I won't miss any meals. I won't miss my services. I'll just rely on somebody else to pay for it out of the goodness of their heart. Politics. Politics as usual in Springfield. We want to say on one side we want to balance the budget and we want to control spending, but things like medical services that Medicaid is currently required by law in the state, we're just not going to pay them, and we'll guess the hospital will have to write it down as charity care, or the doctor will have to write it down as charity care because Grandma Jones showed up at the emergency room. Maybe her Medicare will pick up some of those. Maybe they won't. But to cut $276 million for services that in most cases, or in many cases, are still going to occur. The Senate and the House knows that those services are still going to be provided. The governor knows they're still going to be provided, and just say, well, that's your tough luck providers, we're not going to pay them, is not right.
So you talk about Medicare possibly picking up part of the bill. Bottom line is this a tax increase on you since you pay your medical bills and the hospitals and doctors have to recoup those losses somehow? Are they going to charge you more now?
Well, many hospitals are, and I, as a matter of full disclosure here, I happen to sit on the board of St. Anthony's Hospital, and we provide a large percentage of charity care. That is the mission of the sisters. That is the mission of the hospital, to help those that otherwise cannot pay. But there is a limit. The services are still provided by people who expect to get paid. The doctors expect to get paid. The nurses expect to get paid. If you use supplies, those suppliers still want to get paid. So somebody is out of pocket here. Are they out of pocket 100%? Medicaid and Medicare are some of the lowest payers anyway in negotiated rates. So you can't say to the nurse or the doctor or the anesthetician or the ER doctor, well, you're just going to have to eat it on this one because this person doesn't have any insurance and the governor cut the Medicaid and their Medicare is maxed out. You go ahead and provide the services and you just take it as a loss. Those people have to be paid too.
Sam, the governor cut $276 million out of the state budget that was allocated for Medicaid. That was going to be used to cover bills for doctors and hospitals. The legislature failed to override that veto. Is that a right move to take that money out of the budget?
No, in reality, it's immoral. It's indentured servitude. It's saying to these medical providers who, in essence, in good faith, entered into a deal with the state and said, yes, we will care for the Medicaid patients you send our way in exchange for payment by the state. It's basically stealing from those people. Here's a corollary. What if I decided, and Jim's going to quit eating, but he's going to go to the restaurant and put it on a charge card and then expect the restaurant to pick it up. In order to balance my personal budget, I have just decided to cut the state out of my budget, and I'm not going to pay my 5% income tax that I owe to the state. Is that all right? Well, no, it's not. The state will have me locked up and thrown in jail if I don't meet my obligations to the state. So why shouldn't the governor and the legislature be locked up and thrown in jail for not meeting their obligations? The governor has not cut $276 million out of the budget. He has basically just defaulted on a government obligation, and in reality is simply pushing it down the road and digging an even bigger hole for the state. So no, it's not the right thing to do on the governor's part, and no, it wasn't the right thing to do for the legislature not to override that. They're just kicking the can down the road. For some of them, there's an election coming up and they're not going to return, so they're not going to have to mess with it, and somebody else will have to. And, Governor Quinn won't serve forever, so somewhere down the road, it'll be some other governor's problem to figure out how to dig out of that hole. But if the state doesn't eventually pay those medical bills, then in reality, you were right, you touched on it earlier, it just becomes a hidden tax. Somewhere, those medical providers will have to recoup those losses if the state doesn't meet its obligations. And that will result in higher rates to those people who are paying their medical bills, or to the insurance plans that are paying on our behalf. And we'll all just pay higher costs for our medical care down the road because the state didn't meet its obligation. It's not right, it's immoral.
And don't think there's always going to be a hospital there to provide. Let's look just in our regional area here, a couple of failures in the East St. Louis area of hospitals that closed down because they didn't get ample Medicaid and Medicare reimbursements. They finally said, we can't afford to operate this anymore, we're going to shut her down.
Well, and it's also an issue because there are people through no fault of their own that are on Medicaid, or people who are on Medicare by virtue of their age, and they can't find a medical provider because certain doctors and groups simply say, we don't take Medicaid, we don't take Medicare because we're not getting paid. And now those people are out there wanting for health care services. Through no fault of their own, they can't access it because the state isn't paying its obligations.
You mentioned pushing the payments down the road. Are we getting closer to the point where the state can't push them any further down the road and finally has to say, forget it, we're not paying that bill, you might as well write it off?
Well, in essence, that's what they're doing. At what point in time are the hospitals and the doctors and the other medical providers going to say, getting paid 5 years down the road, 7 years down the road is like not getting paid at all?
We need to take a break. We'll have more Metro Talk in just a moment.
Hi, I'm Audrey Lucchese, and I'm from Alton, Illinois. I love music, and that's why I came to Lewis & Clark. It's been an amazing experience here at Lewis & Clark, working with students that are so talented, coming from all over the area, and they work so hard to follow their dreams. The music faculty at Lewis & Clark they're fantastic, and they're there every step of the way to push you to follow your dreams. One of the unique opportunities that I have had at Lewis & Clark is being able to record my own music with a fellow student here. Being able to record our music has opened doors for us in the music industry. My long-term goal is to finish here at Lewis & Clark and then to transfer to a four-year school and finish my degree in music performance. I would recommend Lewis & Clark to another student because it is definitely a great place to get started and it can open so many doors for you.
Big dreams and good grades aren't enough to get into college. There are actual steps you need to take. finding someone who can help is the first and most important. For the next steps, go to knowhowtogo.org.
This is Metro Talk. I'm Ken Scheffel. Jim Schrader and Sam Stammer here. Sam, Governor Quinn says he'd like to see tax relief for both businesses and citizens. He says he supports a research and development tax credit, as well as expansion of the earned income tax credit. In light of the state's budget problems and everything we were talking about in the first segment of the program, can we have tax cuts too?
Oh, in a fantasy land, yes. You know, why didn't the governor think about tax cuts for all of us before they raised the income tax for both businesses and the personal income tax last year? Yeah, you know, it all sounds good. Hey, let's give people tax cuts, but on one hand, and then on the other hand, we don't have enough money to pay our bills. The only way the state's going to dig out of this hole is to sit down and figure out some real spending cuts. And they're going to have to be across the board. Everybody's going to have to swallow a pill along the way. And then, you know, once you get to the point where you can pay your bills, meet your obligations, then you can start figuring out where you can do some targeted tax cuts that perhaps are going to help spur the economy. But one of the problems is it's very difficult for businesses to make plans to expand and to hire new people and to anticipate growth, because there's all these question marks about, you know, what's coming next? When's the next shoe going to drop? Because it's easy to see. It doesn't take a genius to figure out that the government, whether it be the state government, the federal government, and I'll exempt local governments, because a lot of local governments have made the tough decisions and made the cuts that were necessary to keep themselves viable. But in the state of Illinois, at the very least, and in Washington, D.C., you know, they just don't have the fortitude to do what needs to be done. And, you know, business people are sitting back and saying, well, you know, we can't make any plans because we don't know what the future business environment is going to be. What, you know, where's the next tax that's going to hit us? When are they going to push their costs over onto us? So therefore, you know, we better just sit here and sit tight and wait until we have a clear picture of what's going to happen down the road. So, you know, the governor's out there in some fantasy land talking about tax cuts when, you know, the state is nowhere near meeting its obligations. It's really just nonsensical, and I don't think people are fooled anymore. There was a time when people were fooled by the rhetoric. People are not fooled by the rhetoric anymore. What do you think? Where do you think the Occupy Wall Street comes from? Where do you think the Tea Party comes from? It's people saying we've got more common sense than these people we've sent, and that's part of the reason I think, you know, next year you're going to see a lot of incumbents sent on their way, and that's why you've seen a lot of incumbents just say, hey, we're not even going to run because we see the handwriting on the wall.
Jim, is it a situation where we could have both a tax cut for individuals and businesses like the governor says he'd like to see?
Well, the three of us are all the same age, and we all grew up watching Westerns. And what the chief would say is, great white chiefs speak with forked tongue. You can't have it both ways. This is the state that in January raised the personal income tax by 67%, raised the corporate tax by 76.5%. And then as some of these major employers in the state said, we can't pay that, they immediately set about abating taxes, rebating taxes, giving tax incentives to get these businesses not to move out. CME, Caterpillar, Sears, Kmart, different ones saying, whoa, you know, we'll take care of you. We'll just make sure that everybody else pays 76% more in taxes. You can't do it both ways. On a much simpler plan, that's why so many people advocate a flat tax for personal income taxes, the same way with the corporate tax. You know what the bite is going to be. You know it's going to be 3%, you know it's going to be 5%, you know it's going to be 4%, and it's going to be across the board. But if Sam's company pays 76.5% more, and my company pays 76.5% more, and this major employer over here rattles his saber loud enough and says, well, you know what, we're going to move to Indiana. They said, well, we'll cut your taxes. That means Sam's company and my company is paying for that guy, that squeaky wheel, who rattled his saber more loudly. So we're taking it on one hand and giving it back to a specialized few on the other hand. It just doesn't work. You can't, just like back to the first question we opened the show with today, you can't cut spending and still expect the services. You can't raise taxes and then give it back in a state that's broke. You can't say, well, we're going to give you all kinds of tax incentives for research and development and developing new products if 6 months later we told them we're going to have to raise your taxes because we're broke.
Sam, you brought up an interesting point a minute ago. You said you would not fault the local municipalities because they've made the hard decisions, unlike the state and the federal government. Why do you say the local municipalities have made the hard decisions, and why haven't the state and federal governments?
Well, many of the local governments don't have any choice. They don't have the ability to borrow money or to print money like the federal government does. And so, you know, it's either make the cuts or go belly up. You know, and there aren't many municipal workers that are going to come to work if they're not getting a paycheck. So they are forced, they are put in a position where they have to live within their means. And many of them are suffering the same plight that the hospitals and the doctors we talked about earlier. They were promised money from the state, or they had an expectation that state money was going to come their way, and suddenly that spigot shut off. They don't have any choice. We need to start cutting services. We need to start laying people off. We need to start scaling back. We have to live within our means because we have no opportunity to go out and borrow money or print money. And so, you know, many of the local governments are much like individual families. You either live within your means or you go belly up. And, you know, so they've been forced to do that. Why doesn't the state? Well, because they can get away with it, at least so far. At some point in time, though, you know, that's going to come home to roost, and they're going to have to pay the price. And, you know, we see what's happening in Europe. The same thing is going to happen to our federal government. If we keep spending beyond our means, we're going to go down the tubes just like Greece or Italy or some of the European nations.
Even our local sales taxes are collected by the state and then rebated back to the local communities. So if someone, you know, collects sales tax on a purchase at Alton Square, the state collects the money, and then the local portion is supposed to go back to the city. The state is even trying to reduce the amount that they send back to the cities, which is why Mayor Hakes and others have traveled to Springfield on several trips saying, wait a minute, you can't do that. We have a city/business to run, and we have to count on that money, and you can't attach that money and expect us to continue to operate.
We need to take another break. We'll have more Metro Talk right after this.
Hello and welcome to the Lewis and Clark Minute. Today we're going to check out the radio broadcasting program in WLCA with Mike Lemons.
Have you ever listened to your favorite radio station or your favorite disc jockey and say, you know, I could do that? Or maybe you're the type of person who says, I could never do something like that. Well, with the help of first-year mass comm student John, we're going to show you just how easy it is. Each voice intro starts with talking about the band that just played, and we add a station identifier. Next, you want to offer some information that may be of interest to your audience. And finally, tell the listeners what the next song is, who sings it, followed by another station identifier. John will do one live now.
Solar Sun Pickup Substitution on WLCA. The Big Pink released their debut album called A Brief History of Love. This single is off that album. It's The Big Pink with Dominoes. It's on College Radio's Best 89.9.
This has been your Lewis and Clark Minute.
What's that? I don't know. Something I kind of made. Ooh, what's it do?
What do I do? Well, thanks for asking. I ring my bell and I like to dance. What do I do? Well, thanks for asking.
Ow! Yeah, it still needs a little work.
Anything's possible. Keep thinking. Get started on your own inventions or just play some games at inventnow.org.
Sounds like you could use some Van Gogurt. It's fortified with arts-rich nutrients to improve your math and reading skills. Catch!
Van Gogurt. Thanks. So what's the deal with your ear?
Always with the ear, huh?
Feed your kids the arts. For 10 simple ways to learn how, visit AmericansForTheArts.org.
You're watching Metro Talk. I'm Kent Shuffle. Jim Schrader's here. Sam Stem is here. Time for the media guys to get serious now about emergencies. Jim, last week a national emergency alert test was conducted nationwide. Did that test make us safer or more secure? Did it help?
Well, we all grew up with, this tone, this 30-second annoying tone, and some of us can, recite what it said. This has been a test of the emergency broadcast system, so on and so forth. Ostensibly, the one that we went through last week was supposed to be a nationwide alert where if the IBMs were launched from Russia, as Ronald Reagan so infamously said once, we could immediately take over all of the broadcast signals in TV and radio and alert the world from his hidden bunker buried somewhere deep under Washington, D.C., where he was safe. As I understand it, that can be done anyway, and it really doesn't have to be done with a test. As communicative as we are now, Sam would get a satellite signal that in 15 seconds we're going to cut to the White House or whatever. In days past, you were instructed to tune to the station on the radio side that had the strongest signal, in other words, had the broadest reach to hit the most people. That's not a problem anymore, and with our immediate communication with all of the cell phones and the satellites and Sam's, computers could be taken over by, basically anybody with the right technology. It was feel good. I wasn't dialing through trying to hear all of these because, as some people know, I've had press problems this week, so I had my own emergency broadcast signal going off right then. But I don't feel any safer because of it.
Sam, are we better off? Your station had to run that test. Are we better off because that test took place nationwide?
Well, I think we are, and it's just astounding that in all the years that we've had, first the emergency broadcast system and now the emergency alert system, it's just astounding to me that there's never been a national test. And the test came about primarily because broadcasters have said to the federal government, to the Federal Communications System and FEMA and other regulators, that this system doesn't work. You require us at the very end of the chain to be prepared, but we can guarantee you that this thing doesn't work for any number of reasons. And so for that reason, the government said, well, okay, let's test it and see if it works. And what we found out was that it doesn't work. It needs some fine tuning. The real question in my mind is whether it's necessary to begin with, and Jim touched on that. And let me just take you back 10 years to 9/11. And, the President of the United States was out on the road, the Vice President of the United States and the National Security Team went to the bunker in the White House, and how did they find out what was going on? Radio. By tuning to the media, to radio and television. They were finding out from the media what was going on and not the other way around. If at that point in time it had been required of them to take over the airwaves and explain to the American people what was going on, they wouldn't have been able to tell us. They didn't know. They were finding out through the media what was going on. But the point is that if we're going to have an emergency alert system where the very top levels of the government can take over the airwaves and communicate en masse with the American people, then we ought to at the very least test it. And what they were able to find out in the test last week was that there are weak links in the chain, and I can guarantee you in fairly short order, in probably just a matter of months, there will be yet another test. Because what they're going to try and do is fix some of the weak links in the chain and then test it again and try and identify any additional weak links. Whether it ever is necessary to activate that system in the case of a real emergency is an open question. But if it does become necessary, at least because we've tested it, we're going to find out that it works. That's the reason for testing. I mean, anywhere down the line, you know, we test systems to make sure they work. And if we're going to have the system, at the very least, we ought to test it and fix whatever problems there are so that it will work. And as a broadcaster, if I'm mandated to maintain thousands of dollars worth of equipment so that if the government finds it necessary to activate this system, then at the very least, I want the government to test it, because what we found out was at the very top level, there were problems on FEMA's end that caused problems all the way down the chain. We also found out that there were problems on down the chain where various stations' equipment didn't work, and one station is dependent upon the other. It's a chain of events, and if there's a problem at one level, then everybody downstream is not going to receive the test. But it was encouraging to find out that for the most part, the vast majority of stations were able to relay the test and get it out there to the public. I think once we fine tune it, then it'll be there, it'll be ready to go. But Jim mentioned too, that, oh, well, we've got cell phones and smartphones. Well, what we've learned is that in times of real crisis, those things don't work. They don't have the capacity to alert the public. We found that out in Japan during the earthquake and tsunami there. People, they are a very technological society, and when they turned to their cell phones and the internet to get information, the cell phones and the internet didn't work. We found that out during the earthquake out on the East Coast a couple of months ago. Everybody went to the internet, it didn't work.
We all remember going to the hall and lining up against the locker and playing duck and cover. So I felt as safe last Wednesday as I did in my hallway in my grade school.
That's going to do it for this edition of Metro Talk. Thanks for being with us. Jim Schrader, the publisher of The Telegraph, has been here, along with Sam Stem, the president of WBGC. I'm Kent Shuffle. We'll see you next time.